Sometimes with back pain and sciatica, we do activities or exercises and the pain shifts, it changes, and sometimes it gets aggravated. And the question came up, am I doing harm by doing these activities that are aggravating my back? So what I want to talk about today is sciatica, what causes sciatica, what you need to be aware of as far as motion patterns that may be aggravating it, and what you need to do to make sure it goes away and never ever comes back. The key for you is to truly understand the concepts, and when you understand it, it's better for you. It helps you find a way out, because there is a way out. And what happens sometimes is we're afraid that if the pain shifted, or when I walk I have a little bit of pain, am I making it worse? When you hurt in an effort to activate the muscles, it doesn't always mean you're harming the condition, the disc or the nerves or anything else. What happens sometimes is the confusion or the lack of understanding of what might be happening prevents you from doing the work. The only way out is to strengthen the muscles. So along that pathway, you may aggravate it, and we'll talk a little bit about that. I know all about it because I had it. Severe degenerated disc that was compromising my nerves, causing pain down both my legs. Typical spine looks like this: 24 vertebrae between the head and the hips. The vertebrae are the bones. In between each bone there is a disc. The disc allows for motion of the vertebrae. Inside the spine is the spinal cord. And this is where the pinched nerves come from. So inside the spine is the spinal cord. And then in between each vertebrae there is a nerve that exits directly off of the spinal cord, and it exits the spine through an opening we call the foramen. So 24 vertebrae, in between each vertebrae there is a nerve that exits directly off of the spine. Nerves in the neck go into the arms, nerves in the low back go down the legs. So very often it's in that area where the nerve exits directly through the foramen where the nerve gets pinched. And the question is, what pinches it? Herniated disc is probably the most common, but they all happen for sure. Bulging disc, degenerated disc, stenosis, which is a narrowing of the opening of the spine and the area of the foramen, and arthritis. And they're all connected, meaning one causes the other, and they're all sort of part of the same problem, which is what we've talked about in the past, is the degenerative cascade. Now, the space in between the vertebrae where the nerve comes out, the foramen here, will get compromised. So something will push in there. It's very common that these discs will push in there. This is the bulging disc, this is the herniated disc. As it pushes in there, it's going to start to cause that pain that goes down the leg. So our goal is to free up that space. And sometimes we do the tabletop decompression, sometimes we lay on our back, sometimes we lay on our stomach, but that is all in an effort to open up that space. Also, what happens is the discs can degenerate. Healthy discs looks like this. As it degenerates, what happens is the vertebrae get closer together. That will start to pinch that nerve. Also, what happens is you can develop a little bit of arthritis on the facet joint. That also will start to compromise the nerve. And then you'll get the pain that goes down the leg. So you'll get some sort of dysfunction to the disc, a bulge or herniated or degenerated. Some breakdown of the bone is possible, and then you also will get a little bit of stenosis. All of those will start to pinch the nerve. So one of the things that happens is the pain sensation will change. It'll change from a burning to an aching to a throbbing to a tingling. Some people say their feet are numb. Some people say it feels like bugs crawling on their feet or their arms or the legs, depending on what part of the nerve is pinched. So there's a couple of variables. Number one is what nerve, because these nerves that exit the lowest part are not all the same, and they control something different, but also how much, meaning how long you've had it, and then what part of the nerve is pinched. As that nerve exits nerves are fairly big. And if you push on one side of the nerve, you're going to get, say, an achiness. And you push on another side, you're going to get a numbness. And if it's really being pinched hard, you're going to get a weakness in the muscles. So it really depends on what is going on with the nerve. Now, nerves get pinched, meaning it doesn't require a lot of pressure on a nerve for a nerve to get aggravated. So these nerves, as they exit, the weight of a quarter on the nerve is enough to aggravate that nerve. So it's not a massive pinching of the nerve. It's the weight of a quarter is enough to cause that. And then that will cause the pain down the leg. So what do we know? We know that there are very specific locations where those nerves exit, and each one of those nerves is responsible for a different sensation. And it's not uncommon that if you have an L5 nerve being pinched, sometimes you'll have an L4 nerve being pinched. And each nerve is responsible for sensation and for pain in a different sort of pathway, meaning certain parts of the nerves will cause certain parts of the legs to be achy and to be numb. And also each nerve is responsible for a very specific muscle activity. If L4 is being pinched, it's hard for you to get up out of a chair. It's your quadriceps. L5, it becomes hard to walk on your heels, meaning you lift up your toes, and it's hard to walk on your heels because the L5 nerve is the one that lifts up the toes. And then the S1, when that is compromised, it's hard to walk on your toes because it decreases the muscle strength that allows you to walk on your toes. So each nerve is responsible for a different muscle activity. But what do we know? And the whole idea behind all this is our goal is to stabilize, because certain motion patterns, as we've identified, will cause the nerve to get irritated. So one of the things we did with our MRI study is we identified certain motions aggravate the nerve, and the nerve will, the disc will get bigger, and the disc will potentially get smaller. So sometimes what happens is a very simple motion where you've sort of flexed or extended is enough to push that disc into the area where the nerve is and aggravate the nerve. So that will cause maybe the pain to get worse, or it'll cause the tingling, or it'll cause the burning pain, but it's not necessarily always a problem if the pain goes away. Meaning if you're doing a specific activity and maybe you were bending too much during that activity and it gets a little bit aggravated, it doesn't mean you made it worse. Same thing, those vertebrae can shift front to back. As they shift front to back, simple activities, if you're not bracing when you do it, that vertebrae will shift and compromise the nerve as it exits through the foramen. And more importantly, what happens sometimes is the vertebrae can rotate. These are all core motion patterns, and the whole idea is to strengthen the muscles to prevent this pattern. But what happens with rotation is you'll develop some motion in the vertebrae where it's maybe rotating, and sometimes the pain will shift from one side to the other. So typically when you have a pain that goes from your right leg to your left leg, it's not abnormal, but what it means is the vertebrae are rotating. So the bracing will prevent that, which is what the core activities are all designed to do. Also, what happens sometimes if the disc is pinching the nerve for long periods of time, you'll develop inflammation in the nerve. People say, when is my nerve pain going to go away? Sometimes it's the last thing to go away because we're dealing with the inflammation in the disc. So it's a combination of stabilization, but it's the motion patterns that causes the aggravation to the nerve. It doesn't mean you're making it worse. It will slowly get better as long as you don't keep aggravating it and as long as you start to move well. We know that the abnormal motion patterns are what cause the nerve to get irritated. The flexion extension, the lateral bending, and the rotation, all the motions of the disc. So one of those motions is aggravating your disc or aggravating your nerves. But we have a program, and the program is specifically designed to strengthen the muscles. And as you strengthen them, sometimes the pain will shift and maybe the sensation will change. But that doesn't mean you're harming the disc and or harming the nerve. The activity is necessary. Even if it is slightly uncomfortable, it's necessary because we have to stabilize it. Our goal is to make sure that you do the work to strengthen the muscles. Okay? It's all about activating the core. When you activate the core, what you're doing is you're activating all these muscles, and that's preventing the motion patterns. So the key is to do the bracing and prevent the motion. What is the motion? Lateral bending, front to back, side to side, and the rotation. This becomes your armor. Your core is your armor because that will prevent the motion to the disc. It'll make you stronger, and eventually what happens is the nerve pain will go away. As long as you're not moving into the positions that aggravate it, which is all about stabilizing the core. And then stabilizing the hips and making sure you're bracing. Because a lot of you, when you started the program, your pain was, you had a little bit, your pain was worse, but you didn't have much strength. And then when there's not a lot of strength there, vertebrae move a lot. And when they move a lot, very often they'll move into a position where you're doing an activity and you don't have enough strength to maintain that activity. That's the key. The key is to work all these muscles to make sure you're not getting the micro movements of the vertebrae, front to back, side to side, and rotate. Because all of them will aggravate the nerve. So as that gets stronger, that will slowly start to get away. Why do we get better? We get better because we do the work. The key is to make sure that you understand that you're not making it worse, that you can get better. The goal is to create durability, stability, and toughness and resilience, meaning you've got the strength. The way we do that is through making the muscles stronger that support the spine. There is a way out. We can get you out.